Good afternoon. Our lecture today is about uterine inversion. Uterine inversion is defined as the body of the uterus is turned inside outside, either partially or completely. That means the endometrium, which is the interior lining of the uterine cavity, will be exposed to the exterior. Two types of uterine inversion, acute and chronic. Acute has been discussed in fourth-year lecture about traumatic injury of genital tract, and we know that it is occur as a complication of third stage of labor consequent to the incomplete separation of the placenta and pulling of the umbilical cord to deliver the placenta. It is presented as third stage in neurogenic shock, especially if it is incomplete type. Chronic type. In this lecture, we shall concentrate on the chronic type of uterine inversion. It can be puerperal. It is a partial uterine inversion occur at the time of delivery but pass undiagnosed and discovered weeks or months later. Clinically presented as a profuse vaginal discharge or bleeding due to the infection or ulceration of endometrium. There may be also low backache, chronic pelvic pain, infected hemorrhagic mass in vagina. It is diagnosed by a clinical examination when we feel a mass protrude through cervix in vagina, and there is short uterine cavity if it is measured by using uterine sound instrument. Differential diagnosis of puerperal chronic uterine inversion can be sloughing polyp, retained placenta, ulcerated prolapse cervix, or malignant vaginal tube. Treatment of such type of chronic uterine inversion is by clear up the infection by keep the patient lying flat, so improve the blood circulation to this part of the uterus and cervix, with vaginal douching with antiseptic solution and then vaginal packing. We can use Evelyn's reposter. What is this Evelyn reposter? It consists of a cup on metallic stem with threads. Such cup is inserted over the inverted fundus with continuous pressure applied on it by bracing the patient's waist and shoulders, to which the threads fixed. It is successful within a few days. It can be corrected by traction of round ligament at the time of laparotomy. Other type of surgery that is indicated in resistant cases is by incision of constricting ring of cervix and replace the fundus to its position. This operation either done through abdominal route, so it is called Holton's operation, or through vaginal route, so it is called the Spinelli's operation. Second type of a chronic uterine inversion is senile type. That means it is a spontaneous inversion occur in old age menopausal women, especially if the cervix has been amputated before at higher level by the operation called Manchester operation, which is indicated for uterine prolapse. Clinically presented as incorporeal type, I mean as a profuse vaginal discharge or vaginal bleeding with low backache. And usually this type is mistaken with an ulcerated prolapse. It is treated by hysterectomy. Third type of a chronic uterine inversion is the inversion caused by pedunculated myoma. We know that a myoma arises from the interior of the uterus. It arises by the pedicle attached to the interior of uterus. Such myoma, because of its heavy weight, it tends to expel into vagina. If this pedicle is reluctant to stretch, so traction downward will produce dimple in uterine fundus and then severe inversion. Clinically presented also as a profuse vaginal discharge or vaginal bleeding. Such type, if it is overlooked or misdiagnosed, the surgeon may cut through the fundus while dividing what is regarded as a pedicle of the uterine polyp, so it will open into peritoneal cavity, so that the length of uterine cavity should be measured using uterine sound before we cut the pedicle in order to know if it is really a uterine polyp or if it is the uterine myoma with inversion of the uterus. Thank you very much.